If your lower back has been tight, painful, or keeps flaring up, you might be wondering, what should I actually be doing to help this? Should you stretch it, strengthen it, rest it? The truth is that most lower back pain doesn't improve by focusing on the back alone. Because as we've explored over the past few weeks, your lower back is part of a whole system. And when that system isn't working well, the back ends up having to do too much. Hi, I'm Alexis Weidland, osteopath and nutritionist at Blossoming Me and Healthy Learning Lounge. And in this video, I'm going to show you 4 simple ways to support your lower back by improving how your body breathes, moves, transfers load, and releases tension. Before we start, these aren't about pushing through pain. They're about restoring balance, improving load transfer, and helping your body to feel supported again. And importantly, these can help even if you've been told that you have a disc bulge, a joint irritation, muscle tightness, etc. The first one is breathing, restoring diaphragm movement and reducing the protective state. We'll start with breathing because this influences everything else. So we lie comfortably on our back, on the floor preferably. Place one hand on your lower ribs as you breathe in and one on your lower outer ribs. Make sure that your knees are up so that your feet are flat on the floor. This helps to allow your back arch to reduce and allowing it to drop more comfortably to the floor below. Now we want to breathe slowly and deeply in a nice, comfortable, relaxed way. We're not pushing this, just a little bit deeper than maybe you would normally. What we're wanting to focus on at the beginning is just feeling a diaphragm drop as you breathe in. We're trying to keep all the rest of our upper rib cage and shoulders nice and relaxed, barely moving. So as you breathe in, focus on your diaphragm descending, moving lower into your abdomen. Feel that pulling of that diaphragm muscle, which allows your lungs to fill. And you're focusing on that filling of the lower lungs first. Breathe slowly and deeply, in and out, for about 5 or 6 breaths. Notice that you can mostly feel that in the hand on your abdomen. The next step is to breathe a little bit further than that, just a little bit deeper, so that now, as you breathe in, you feel your diaphragm descend, and then you feel your lower ribs go backwards and outwards. So you'll feel this in the hand on the side of your lower ribs, and you'll feel a bit of extra pressure of your ribs going to the floor. So now we're breathing slowly and deeply, feeling our diaphragm, and as that gets to its completion, then you're feeling the widening of your whole rib cage. And then we're breathing out. Again, do this for 5 or 6 breaths, breathing in and out slowly and deeply, and just focusing on where you feel that movement. Now this allows you to connect with your breath. It allows you to make sure that you're actually using your diaphragm and your ribs and all of the muscles and fascia associated with allowing all of that movement to happen. By breathing deeply into the diaphragm, allowing it to descend properly, we're helping to massage all of the abdominal organs. We're helping to activate the connection between the diaphragm and the pelvic floor, which works together. As we breathe in, they both go down. As we breathe out, they both come up. It helps to support and stabilize the front of the lower back and with the connections into the psoas muscles, and it helps to stabilize and support the lower back with its connections into the thoracolumbar fascia and into the ligaments and muscles that go all the way down the spine. As you do this, also remember to make sure your shoulders are nice and soft and your abdomen is also relaxed. This can help your diaphragm to move more freely and helps to reduce the protective tension that we hold in our body. As we begin to breathe more deeply and allow our diaphragm to fully engage, our spinal muscles and ligaments and the fascia are further supported. It allows the pressure inside our body to change from the chest to the abdomen, and this supports digestion, circulation, spinal support, and specifically the lower back. When all this is working, the lower back doesn't have to work so hard. The next one is movement. So for this one, we're staying on our back, And we're alternately lifting our knees so that we allowing the movement from our leg to transfer the movement through our pelvis, our lower back, and into the thoracic spine. This helps us to consciously support how we're sending movement through our body. So stay with your knees bent, and then you're slowly lifting one foot just a few centimeters off the floor, and then returning it down and alternating with the other foot. We want to keep this slow and controlled and relaxed. What we're focusing on is helping to keep our pelvis steady, keeping our breathing relaxed, not gripping any part of our body, our back, our shoulders, our abdomen. This helps our body to relearn how to move. We're moving the hips without moving the back specifically, and keeping the pelvic muscles, ligaments, and fascia connected, strong, active. This all helps to support our lower back, because if our pelvis is stabilized properly, then movement from our legs can transfer through to our thoracolumbar fascia and our lower back with ease, and vice versa. So for this one, we're addressing tension through the whole system. We want to use a handball, a mini basketball, or a spiky ball, some kind of myofascial release tool. So with this one, we can work into the diaphragm by gently using our hand and putting pressure slowly inwards and upwards into the diaphragm. Or you can push against the wall. When you're using the wall to the front of our body, the mini basketball is better. You can work into the psoas this way as well. So we're using this ball to apply gentle pressure to the muscles beside the spine, using the ball and the wall. So we're gently leaning, so the spine is in the center and we're going just off to the side, and we're just gently pressing. Now you can press and then move the ball, and press and move the ball. Or what's great about a ball is that you can roll. So then you can roll. So we're just going pressure slowly and gently up and down the spine. With this one, if you feel tension into the lower rib cage, you can also do that along the whole rib. We're going across this way. So for this one, we're working into the thoracolumbar fascia all the way down the lumbar spine. So therefore, we're wanting to go down in through here, and we want to go outwards as well and down, because the thoracolumbar fascia is a huge fascial section that goes all the way from the ribs into the pelvis and all of the lumbars. So we're using the soft ball to apply gentle pressure to the muscles beside your spine and across the whole of the lower back and into the upper pelvis. So we're leaning into the wall, or we can lie on the floor. Remember to keep the pressure gentle and movement slow. And make sure it's comfortable, because our aim here is not to cause pain. The thoracolumbar fascia helps to transfer load between our upper and lower body. So when it becomes tight or restricted or dehydrated, load doesn't move efficiently and effectively, and the lower back has to work harder. So releasing this area can help to reduce tension, improve mobility, and restore that load transfer. So the final exercise is a psoas release. This one, we're trying to keep it gentle and very, very safe for anyone who has any problems. So for this one, we're lying on our back with our knees bent so our feet are flat on the floor. This allows your legs to feel supported and your lower back to be supported. So we're doing this in a few steps. The first one is you're placing your fingers just on the inside of the hip, actually pelvic bones, into the soft pelvic abdominal tissues. To know that you're on the right spot, if you gently lift your knee off the floor just that few centimeters, you'll feel the muscle contract and tighten and sort of lift underneath your fingers. When that happens, you may also feel a sense of increased tension, discomfort, or pain. So remember, you're being gentle and careful. But this will tell you that you're in the right spot. Next, you relax your leg back down, and you're just staying there in that position. If you're feeling like this is too intense, it can be really useful then to bring that knee up and just rest your calf on the knee of the other leg. And you just sit there for about 30 seconds or so. Stick with 30 seconds, or if you notice that the tension under your fingers softens just a little bit, then that's enough. From there, you can come a little bit further up and a little bit further up still. As you come further up, you may get increased tension and pain, because if the psoas is tight in those areas, it's also going to be connecting into the fascial system of the abdominal organs, and so this can make it extra painful. Again, if you're not sure if you're on the right spot, when you lift your knee just that little bit off the ground, you will feel the muscle lift under your fingers. When you feel that, you know you're in the right spot. Again, you want to just hold that for around 30 seconds or so. Or if you notice that everything softens a little bit under your fingers, then that's enough and you can stop there. Now, as you go up higher, it can be beneficial to bring that leg so that your ankle is sitting on top of the other knee instead of just the calf. That's bringing your knee a little bit closer to your stomach, reduces the tension on that whole iliopsoas muscle, and that allows the muscle to relax more effectively. Now, the third step, if you feel comfortable in doing so, you can keep your fingers in that position, take your leg off the other leg, and slowly and gently straighten the leg straight down. And as you do that, you're stretching the iliopsoas muscle, so the tension and the pain can be increased. So if the pain is too much, stop and make sure you're going slowly. So you straighten your leg, and then you gently bend it back up so that your knee is up over your abdomen again, and then you straighten the leg again. Do that 3 or 4 times, as long as it's comfortable and as long as you're being really slow. You should notice that the tension under your fingers will then soften further. This is a deeper technique though, and it can be quite painful and it can irritate some things. So make sure the pain is not intense. You can have an increase in discomfort, but not true pain. You want to make sure you can breathe comfortably and relaxed. Nice and deeply also helps. And if you're unsure about what's going on, make sure you talk to a health professional to see what's going on. The psoas connects to your spine, to your pelvis, and to the inner thigh or your legs. So when it's tight or protected, it can pull on the lower back, increasing the load through the lumbar spine, altering the position of the pelvis and the sacrum, and causing the abdominal contents to kind of push out. In that position, it's very difficult to have your abdominal muscles switched on correctly. So it often causes the abdominal muscles to switch off, which then makes the lower back less protected. By bringing the pelvis back into the correct alignment, we're allowing the lumbar spine, the ligaments, and the muscles all to be in a better position to be able to reduce tension, to improve alignment and circulation and fascial pulling, support the discs and the ligaments and the joints themselves, to reduce tension, to reduce pain, and to improve movement. And with all of this, the load transfer is then improved. So remember, for all of these techniques, we're not forcing a release. We're allowing the body to let go as it's ready only. And it works on the 4 main areas affecting the lower back: breathing, movement, fascia, and deep pelvic stabilizing muscles. When they're all working together, the load that affects that lower back area is shared. Movement is freer and easier, and the lower back is then supported. Remember, you don't need to force change, and you don't need to push through, and pain is not actually required. In fact, it can go against you. Small, consistent improvement in how your body breathes, moves, relaxes, and transfers load can make a huge difference. If you'd like guidance and more specific personalized support, book in for your personalized assessment today. Please remember though, pain doesn't necessarily mean that something's actually damaged. Often, it means that the system needs better support. And when you start improving that whole system, the lower back begins to feel better too. I hope you found this helpful and useful, and I'd love you to stay connected. Please remember to like and subscribe, and share, especially if you think someone else would also find it helpful.
So that's it for today. Did it raise any questions or aha moments? If so, I'd love to hear them, so please put those in the comments section. I love answering questions. I hope you found today useful, and if you know someone who could use this information, please share it. Remember to comment, like, and subscribe. Until next time, and in health, bye for now.